Good morning, or good evening, Pahrump. Excuse me, it's been a long day. Sitting here with Dr. Creig, so you got Dr. Creig and Dr. Creig. Very excited about answering your questions tonight. Actually, our first day that we have worked together as a team, a very successful day, treated a lot of patients, seen a lot of things today. It was very interesting. How was your day?
It was excellent. We saw a lot of musculoskeletal issues in people that previously had not recognized them. And it's wonderful having a colleague that I can walk down the hall and ask how to handle things and how do we go from here.
And that's cool. Let me say, Dr. Reiner is on his way. He will be here. He had a few more patients to see in his office. But let's get those phones ringing. Let's get those phone calls and those questions coming in tonight, Pahrump. We're in the Christmas season. Traffic is absolutely crazy. I was in Vegas this weekend and probably seen 4 accidents in the first 20 minutes that I was there. So you guys be real careful on the roads out there this time of year. Probably not as crazy, the roads, as from where you're from.
Well, no, but you know, speaking of that, we have our construction around here in town as well. I've had 2 or 3 people who have been upset that the obstruction is there. It takes me 2 minutes longer. Their blood pressure's higher when they get in the office, and it's really not necessary. Do a little planning ahead. It's good for any medical care. It's also good for just getting to our office. If you're a couple minutes late, gee, it's not to worry. Of course, doctors are never late themselves, so yeah, take a little extra time, but take a breath. We understand that these things happen.
And remember, it's the season, people. There's just so many people on the road. Ray.
Hey, Ray the Flagman here. How you guys doing tonight?
We're doing good.
Very well.
We're doing good. We're waiting for the quarterback to show up.
How are you going to fit 3 years on the screen? You know, you got to move the camera a little farther back. You know, tell me the technique he's going to use.
We're going to go side to side.
Either that or we won't show him at all, Ray, and we'll just hear his voice.
Voiceover.
Yeah.
Yeah, all right. Sounds good. I've been talking to people with diabetes, and I talked to a fella today, and I'm concerned because he said that he had a deal where his feet got real cold last night, and one toe is blue, and he doesn't know what to do about it. And I said it's probably poor blood circulation. He's trying to keep it warm. He's worried that if it turns black, there may be amputation. Is there something he can do to treat it, to warm it up, or to get the toe some circulation back into it? Now, you guys are into exercise and everything else. Would you have some solution that I could tell him?
I would not exercise that foot. That is going to be an arterial problem. That's a pretty big deal. He should be seeing somebody, if it's real painful, probably tonight. If not, he ought to see someone early in the morning. That's a medical emergency, Ray.
But the blue, what does the blue mean? That it's not getting any blood circulation?
Well, it's getting some, but what's happening is the blood is very slowly moving through that area, and so much oxygen is being taken out of the blood that it goes from red to blue. Mm-hmm. Well, there's an awful lot of causes of a deal like that, and some of them can be limb-threatening, all the way up to the knee and possibly even closer to the body. Mm-hmm. So I'm quite concerned about that story. That's somebody needs to take a look at that.
He actually got it through incarceration, and they wouldn't give him anything warm for his feet or anything else. You know, the local jail, they don't treat you like a king or a queen when you're in there. And that's how I happen to notice, because the fellas, you know, people in custodies, when they get released, sometimes, because I'm at the courthouse every day, they come and talk to me. Yeah. And he tells me this, and I said, you know, that sounds, I said, why don't they give you something like blankets or whatever? They just don't care locally. They just figure you're going to figure it out, you're going to handle it. And this is serious stuff. I know Dr. Reiner goes in there and sees these prisoners, and he ought to, you know, keep it on the top of his chart to say you got to keep these people warm and comfortable. Just because they're in a slammer, you don't treat them like animals. So that's what I see.
Well, it's not up to us to comment on law enforcement, just on the medical side of it, as you know.
Well, it is if they're mistreated in there.
Well, I understand your position. Does this fella have a doctor?
Yes, he does. He has a doctor, and I told him to see his doctor. But the idea that they would let it happen, and it's not an isolated case, Doc. I mean, I hear this stuff all the time. The meals are horrible there. They're not feeding them right. Sometimes when I'm there for the in-custodies, when they're all lined up, they see the judge in the morning, I'll ask the jail guard, are you feeding them okay? And maybe 6 people yell at me and say, hey, flagman, get us some food. They're starving us in here. So, you know, Reiner goes in there every so often, let him be aware of some of these things that are going on. And I'm sure that these inmates are going to confide in him and tell him what's going on. It's just not right. You got to treat people like people.
Do they have a jail doctor, Ray?
That's Dr. Reiner.
It is Dr. Reiner, okay.
He's in there once a week.
All right, so he and I'll take a look at that. I appreciate that insight. We're on the outside looking in, and you're just the opposite, looking out and trying to reach to us. So very much appreciate the information, and Doc and I'll take a look.
And one last thing, is diabetes hereditary? Because my family is noted, my dad had diabetes, and one of my brothers had diabetes. I haven't been checked out for 10 years. My blood sugar was okay at that point in time. But I mean, is it something that, is it diet? If I'm eating it properly, I can pick it up, or is it usually genetic where I can get it from family, whatever? And then I'll open the line up, but you could tell me on the air, and I appreciate it.
Thanks, Ray. Yeah, it's not an either or, it's a both and. It's both hereditary and environment. There are many genes that are involved in diabetes, many parts of the body that are involved, and if one or the other parts, particularly the pancreas that makes insulin, isn't working well, then pretty much likely you're going to get diabetes. It's also possible to eat too much, and if you have a normal pancreas, it can't keep up with all that extra weight.
Lifestyle's definitely an issue.
Oh boy.
With adult onset diabetes. And a lot of times in my practice, what I see is if I get these people on a diet, we drop 15, 18, 20 pounds, and we get them exercising and eating much cleaner, we see some pretty dramatic changes in their insulin levels and the blood sugar issue.
Well, we do, and there's certainly many medications. There are 8 different categories of pills for diabetes alone. They work on the pancreas and the liver and the kidneys and the muscles. It goes on and on, even before you get to insulin. Well, as doctors, we love to prescribe things, and what Dr. Christensen is saying, I think, is true, is that if we can get lifestyle changes through diet and exercise, diabetes can go away. You don't need the Dr. Creig, you need the Dr. Christensen, and we're happy to work as a team.
We see the same. We've seen the same results with high blood pressure.
We do.
Also, Dr. Creig.
Yes.
You know, if we can get people to come in, we can get their heart rate up to 135, 140, and maintain that for. It takes a while to get it to a prolonged period of time, maybe up to 20 minutes or so, 2 or 3 times a week, and they start dropping adipose. It is absolutely amazing what happens with their blood pressure.
It's quite striking, and diet is involved there as well, as you know, with salt and with weight in general, cholesterol-containing medications and foods. It goes on and on.
Roxanne.
Hi,
Good evening.
I have a quick question, and then, like Ray did, I'm going to hang up and run to the TV and listen to you. My question is, I caught whatever's going around, and it is terrible. But the thing is I know it's a virus, and that antibiotics cannot treat viruses. But I don't understand, and maybe you could explain to me how a virus becomes bacterial. I went to the doctor, and I had to get an antibiotic because my virus had become bacterial. And if you could explain how that phenomena, or maybe it's not a phenomena, how that happens, I would really appreciate it. I'll hang up now and let you explain that to me. Thank you.
That's in your wheelhouse.
Sure. Virus, there's an awful lot of it around. People develop a cough, low-grade fever, muscle aching, maybe a little bit of clear mucus. Oh, some people are asthmatic, so they may wheeze, but it's over in 4 or 5 days. What has happened during that process is that the immune system, the white blood cells, have been fighting, and it gets a little bit worn out. So an opportunistic bacteria comes in. Well, what's that? Somebody's coughed on you. Maybe it's a bacteria that you had in your own throat anyway, and it gets inside you in the lungs and the sinuses before the white blood cells can recognize that they're there. So the virus beats you up, the bacteria comes in, it is very common. So now it's been a week, I'm coughing, and all of a sudden I've got a little higher fever. I may be coughing up either green or yellow sputum. My fever is 100 degrees or more, and I might even cough up a little bit of blood. All of that is bacterial. In general, when a person comes to the doctor's office and says, I've got a cough, and it's only a few days, it's clear mucus, that's viral. When it changes to the other things we mentioned, it's usually bacterial, something that's needing to be treated, usually with antibiotics.
So, what I understand you're saying is your body is compromised. The white blood cells aren't prepared to fight the bacteria. The bacteria comes in, invades the system, and sets up, and that's what you're fighting.
Yes, I think that's true. And I think many people fight through the virus thinking, well, I've got to have every activity that I had before. My diet isn't as good. I'm not resting as much. I'm not taking fluids. I'm not doing vitamins. And all of those things are necessary if we're going to keep that bacteria from coming in.
Excuse me, Doc. We're going to break right now. You guys hold your questions. This has so far been a very, very, very good segment. Keep those questions coming.
Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.